Good afternoon, everyone. I'm Melanie Escher with the Arizona Telemedicine Program, and welcome to another session of some of our educational programs we have. Today, so as you joined, of course, your microphone or your phone are muted. Please use the Q&A in the chat function. If you have any questions for our speaker today, Ms. Jan Ground. There's also a post-webinar evaluation. Please go ahead and fill that out. We are being recorded, and the recording and the handout materials will be listed on our website afterwards at that web address. You don't need to worry about copying that down. I will send out a thank you email to everybody that joined us today, so you will get that information, including the evaluation link, although it will populate a window once we are done with this session today. Standard disclaimer. Opinions expressed in the presentation and on the following slides are solely those of the presenter, not necessarily those of the organization sponsoring this event. The organizations do not guarantee the accuracy or reliability of information provided herein. All right, and again, so here your opinions are valuable to us. This is our main website where you can see upcoming webinars. We've got about 10 more webinars scheduled through December. So please go ahead and check our website and sign up for some other educational events. Again, please go ahead and do that evaluation. Ooh, this does not have CME on this webinar session. I'm gonna have to update that slide. All right, so without any further ado, I'm going to introduce Jan Ground. She worked with Kaiser Permanente. She's retired. She is our Colorado liaison for the Southwest Telehealth Resource Center up in Colorado. I'm gonna go ahead and stop sharing here, and I will get her slides put up. And Jan, if you would take a moment and maybe give just a little brief intro here just while I get your slides up.
Should I go ahead now, Melanie?
You may go ahead and talk. Yeah, let me get your slides up. Yeah, go ahead as I get your slides up.
Great to see everybody. Thank you for listening in. As she said, I'm retired. I've been retired from Kaiser Permanente for 7 years. I started my career on basically telling you how old I am in 1980 as a pediatric physical therapist in children's hospitals on the East Coast. Now I hold babies in the NICU as a volunteer. I got an MBA along the way, and I spent 18 years with Kaiser Permanente. And I would say, well, most of those years were with the P of Kaiser Permanente, the Colorado Permanente Medical Group. So I worked with the doctors for most of my years there. And I led innovation for a long time. And then I left. My final role was the director of virtual care. And I want to point out to you, and we're going to go through this more, that I led telehealth. I retired 7 years ago. That was well before COVID. So I'm going to tell you a story that's going to make what I'm going to go through with you today in the next 2 sessions so important. I will tell you that I led the first innovation team at Kaiser Permanente, Colorado. I was the innovation hunter from Colorado with the other Kaiser regions. Everybody else was IT. I'm not IT. I partnered with IT. I also co-led with IT and a group called the Emerging Technologies Advisory Group. And I got certified, this is like 15 years ago, by a group called IDEO, Dennis Boyle, I'm still in touch with him, which is an innovation in healthcare group, and I got certified. I also got certified by a group, and I don't even know if they still exist, called AIM, which stands for Accelerating Implementation Methodology, and that's where I became an expert in leading change. And what we're going to spend most of today on, I added to what they taught me, and I've taught this to many, 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 mostly physicians, mostly Kaiser Permanente physician leaders across the country, and they have given me feedback that even though I added this part to what I learned from AIM, they saw it was the most important part. We'll see if you agree or not.
Great.
I will.
So the other thing I want to make sure that everyone knows is that this is part 1 of a 3-part series. So Jan's going to be speaking 2 more times, but by the end of the year. So please go ahead and sign up for part 2 and part 3. Those registrations are already open, and she's got a lot of experience that she's going to share with us. And I think we're ready to dive in. If you're ready to go, Jan.
I am.
All
And
right.
I just want to tell you that leading people through change, what I'm about to go through, even though I've only taught this and experienced this in healthcare, is true for any industry. It's true for all of us. None of us like to do things differently. And it doesn't matter whether you're a physician or not. I just want to point that out. Any industry, none of us like to change. Okay, let's go to the next slide. None of us like to change. So go ahead and read this to yourself. And I will tell you that I chose physical therapy over occupational therapy in 1978 because I wanted to be hands-on, and OT does autism and other things. And guess what? I would not be excited about telehealth if I was in physical therapy now. Let's go to the next slide. So this is basically saying, if you choose to go fast, like you tell everybody, this is what we're going to do. We're starting tomorrow, do it, period. You will start fast and you will fail. And I will tell you my story of my failure. Or if you do more what I'm about to go through with you today in the next few sessions, it will be slower and it's painful, but you are much more likely to succeed. That's my opinion. And obviously you can put in chat anything you want, but I will also tell you, you can go to the next slide, that I'm going to ask for feedback in the chat. And hopefully, as I said to the sponsors, at least 2 or 3 of you will give me an answer so I can respond. Go ahead and go to the next slide too, which has all of them. So when I taught a full day in-person session on leading people to change, telehealth or not, these are the things we went through. First things first, I'm not going to go through with you today or any day, but are you basically going to say, this is what we're doing, do it and shut up? That's not what this is about, but decide that first. The second one, we're going to spend a lot of time on today, especially what's the problem. The third one, we're not going to go through in any of the sessions, but that's what I would add. The fourth one, sponsorship is critical, and I will go through that at the second session, as well as servicing and managing resistance. It is absolutely critical, or the doctors, whoever, me, will go against you and you won't even know it. I'll go through that in the second session. We will skip communication plan and clarify expectations. We will definitely talk about reinforcement strategy at the third session. And again, if anybody wants to make any comments in the chat, go for it. Otherwise, we can do it at the end when we open it up for questions. Okay, so let's go to the next slide. This is the main topic of today's session. It is the most important thing, in my opinion, not so humble, about successfully implementing change when you need people to do things very differently. So let's go to the next slide. And I'm asking everybody right now, please write on a piece of paper for yourself, because we're going to come back to this. And at least a few of you write an answer in the chat. What is the or a problem that Arizona would like to address, or your state, wherever you are, in offering care by telehealth? I'll give you 30 seconds. I see one in the chat. Good. Thank you, Lisa. Thank you, Catherine. Thank you, everybody. Okay, I hope and assume you can keep putting them in there, and or you can listen to me and not worry about anything else. Let's go to the next slide. Oh, first I have to tell you my failure before we keep going. So probably in 2015, long before COVID, we had about 1,000 physicians with Kaiser Permanente, Colorado, and we trained one-on-one, all 1,000. I might be exaggerating a little bit. All of them had 30 minutes one-on-one training. That's 500 physician hours. And we gave each of these 1,000, mostly physicians, a $200 webcam. Count the number 1,000. And a year later, I have the data, 97 out of the 1,000 had done at least one video visit. That is a waste of time and a waste of money, the biggest failure in my career, period. I don't want you to have to go through that. And obviously COVID changed everything, but I can tell you that I know this for a fact, that doctors are still not excited about this. Either am I, as a physical therapist. I want you to now put in the chat at least a few people. You don't need to write this down for yourself. If I told you that the problem we're trying to solve is my teenage daughter's social life, what would your solution be, or what would be an example of your solution? Again, I'll always be looking for 2 or 3 responses in the chat. I'll look for one more in the chat. Thank you, everybody. Thank you. Now, suppose I told you now, and you said to me, before you answered, you said to me, because this is what I would say to you, well, what's the problem? I mean, in my opinion, the words "my teenage daughter's social life" is not a problem. Yeah, she has a social life, she doesn't have a social life, we don't know what it means. Suppose I told you she has no friends and she doesn't have a phone. Would that change your answer? Of course it would. So again, I'm pointing out to you, first of all, this is not stated as a problem. It's just a statement about something. It could be great. And we don't know what's wrong with her social life. So let's go to the next slide. And consider what I've been saying in response to this. Or again, I'm going to look for 3 responses. Now I'm telling you the problem I'm trying to solve is hospital service. What might be a response? One more. Okay, good job, Lisa and Monica. You're getting the idea of I'm not telling you anything wrong. Okay, now suppose I told you that 30% of our discharges are readmitted in a day. I would suggest to you, everybody in this group would say that is a problem to solve. Now, I suppose I told you instead, 1% of our discharges are readmitted in 5 years. Would you say that's a problem? And I'm guessing everybody in this group would say no. So again, I'm getting to where I'm getting to of, I'm looking for something stated as something wrong, and I'm looking for how bad is it? And the challenge is that not everybody will agree on this is a problem worth solving, especially if you compare the people that you want to do something different, like having doctors do care by video and having the executives decide what they're going to pay for. We have bigger problems, or this is our biggest problem. So let's go to the next slide. And this is basically what I'm looking for. Now we're going to go back to what you originally said were the problems that Arizona is trying to solve. Validate that there is a problem. So hospital service, if you said to me our hospital service sucks, I would say that's a problem. And then if I said to you, make sure it's quantified, how bad is it? I would say hospital service sucks is not quantified. And then know how you'll know if the problem has been solved. An example of that, this is a real story. I taught this to a group of executives, one of the hospitals in Colorado that Kaiser Permanente used to partner with, because we don't have our own hospitals here in Colorado. And the problem that the emergency room physician leaders were trying to solve was that the doctors would not use the computer system. This is a long time ago. And so they were going to replace the system. And I said, okay, if you replace the system, are you sure that that's going to solve the problem? And the answer is, of course, it wouldn't have solved the problem. Hopefully, not hopefully, I did convince them, do not replace the computer system until you find out why they won't use it. I mean, if they're telling you that this system is so bad because it's only in Greek, yes, you need a new system. But if you're telling you, then you ask them why, and they say, because we don't like typing or we don't like computers, this is a long time ago, you're not solving the right problem. So solve the right problem. And then the last one I already mentioned is, This is really hard and sometimes impossible. When Kaiser Permanente Colorado chose to go live with video visits long before COVID and we failed, the executive physicians that I worked for wanted to increase the retention of what at least we used to call LUMs, low utilizing members, the young people. I'm in my 60s. The young people in their 30s that are members, but they never use our care, so we make the most money out of them. We want to keep them more, and we have no idea, but if we think we offer care by video, we might be able to retain them. The doctors, and believe me when I tell you, I idolize doctors, so we have doctors on the call. I am with you. Doctors couldn't care less about that. Doctors care, and obviously I'm exaggerating to make the point. You guys care about outcomes. You guys care about the right care to get the right outcomes. So let me just look at my next slide. A few more slides, and then I'm going to work on yours. Let's go through 3 more slides, and then I'm going to stop babbling for a while and let you work on yours. So I'm going to answer for you. I'm not going to make you answer for me. There's 3 steps. One is state as a problem. I've already gone through this. The word service, our service is not a problem. To improve service, if it starts with the word TO, I'm guessing it's not stated as a problem. On the right side, it says our service is lousy. That's a problem. We don't know how bad it is and we don't know the cause, but we know it's a problem. Let's go to the next slide, 2 of 3. Okay, how bad is the problem? On the left, it is not stated of how bad. And the reason it matters, again, is because if I tell you 1% of our patients discharged are readmitted in 5 years, that's not what the executives are going to want to spend their money on, period. End of sentence. And the challenge with this is people don't agree. 10% of our patients indicate that they are very satisfied with the care they received. It's nothing to do with my opinion, whether I consider that's a problem. It's quantified, but suppose I told you 10% indicate very satisfied and 75% in addition to the 10% are satisfied. I'm guessing, I'm making this up, you have bigger problems to solve. I'll never forget, this is another true story. I have no idea who it was, who we worked for. It was a guy. 15 years ago, I was doing remote monitoring. I got all kind of calls leading virtual care. And this guy called me from some company who had a device for monitoring blood pressure for hypertension. And he said, I really want to share with you this device we have. It's great for people with hypertension. And I remember thinking to myself, I did not say it, but I could have, do you know, sir, that we have among the best clinical outcomes on the planet for patients with hypertension, which at least at the time was true. So even if we could have gotten our outcomes 90% to 100%, do you think that's the problem that we want to spend our money on? 0% chance. So, but then suppose he then asked me, and I'm just giving you examples of what to think through of how you want to spend your money on innovation and telehealth, because it costs money. If he had then said to me, do you know how much you're spending to get those results? I would have said, and this is true, I have no idea. And then he might have said, well, might you be interested in looking? And I would have checked with the executives of, do we want to look at how much money we're spending and seeing if we can cut that in half? I have no idea if that would have been a priority then. We had much bigger problems with diabetes. I don't know. Okay, 3rd slide of the 3 of what we're looking for, and then we're going to work on your stated problems. Might others say so what? Again, I've already gone through this. Okay, so look at the asterisk on the bottom. The others include those with the resources, usually the executives that choose how to spend the money. Are we going to buy all the doctors' webcams? Are we going to spend all this money on, we used VIDYO a long time ago. We're going to spend all the money on that for this or not. And then the other group is those you want to do something different, like in this case, the doctors, but obviously it's not just doctors. In 2024, 90% of our patients indicated that they were very satisfied with the care they received. I would suggest everybody in the others would say, so what? And you don't have to disagree or agree with me. I assume you agree with me. That's not a problem that we need to focus on. We would love to get it to 100%, but we have bigger problems in this industry. As compared to 10%, I think most of us would say, yes, we need to solve that problem. But if it said 50%, if it said 60%, if it said 40%, 30%, 80%, it's a hard problem to solve, to figure out what that right number is, to make it a priority. And I can't tell you how to figure it out. I will just tell you it's hard. So I hope I've taught you a bunch already. Oh, no, I have 2 more slides before we work on yours. Oh, we're doing good. It's only 1:20 where I am. Okay, 2 more slides. Okay, and this time I do want you put in the chat, and let's look for 10 people to put it. This is easy. Which is the most clearly defined problem, A or B, according to what I consider a clearly defined problem? A or B? You guys, this should be really easy. You should be able to do this in 5 seconds based on what I just said. Good, 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 good. Okay, fine, that's enough. Obviously, in my opinion. Now, I have had someone say A before because the rising cost is more important than whether it's medically necessary. I get that. But what I'm trying to teach you, in addition to that, is how bad is it? Thank you, everybody, 5, 6 people for saying B. In my opinion, you're right. One more slide, and then we're going to work on yours, I promise. Next slide. Okay, I'm looking for responses in the chat. This one is not as easy as A and B. I'm looking in the chat. Let's see, 3 responses. What's missing? Quantities, amount of time actually, good. Perfect, okay. So what I'll point out to you, and then I promise I'm going to stop babbling at you and let you guys contribute, besides in the chat. Well, no, it'll still be in the chat. So decrease the amount of time. First, I will say, if the problem starts with a word that ends with ing, it is not stated as a problem, even though I think we could certainly easily restate this as the problem we're trying to solve is too much time is, we're waiting too much time between a physician order for physical therapy and the time a patient is seen. We can easily make it into state as a problem, but if it starts with a word that starts with ing, it's not stated as a problem. But let's say we fixed it, and then I agree with you. Well, how much time are we waiting? Are we waiting 1 hour, 1 second, 1 day, 1 year, 1 decade? And again, how bad is it? Okay, let's go to the next slide, and then I'm going to have you work on yours. So I want everyone to go back to, I hope you did what I asked you to do, write what you wrote as what might be a or the problem that Arizona is trying to solve with offering telehealth in Arizona. And I really want to give you a few minutes for this because I really want you to think about it based on everything I said. And don't start your problems with this. Anything that starts with this, it's not stated as a problem. And actually, yeah, that's good. Start working on your own problem that you originally wrote and see if you can make it meet all the things that I said. You know what? I skipped one, Mel or Chris, if you're doing the slides. So let's go to 15, 16. Go to slide 17. So they have that up in front of them. Next one. Perfect. This should help everybody. See if you can state a problem that Arizona is trying to solve, which is why they offer telehealth, so they want to encourage it, that meets these 3 bullets. And when I tell you this is hard, I did this with huge groups of physicians in person. They would work together around the table, and it was really hard. So if you can't do this or you struggle, so does everyone else. So would I if I was learning this. Well, I'm going to say it's 1:25 now, my time. I'm in Colorado. I'm going to say I'm going to give you till 1:27. And you won't get it all right, I promise. Melanie, I saw what you wrote. If you have many that you think they're trying to solve, just pick one. So we're just doing this exercise. Just pick one of them. If you can think of 5, just work on one of them, meeting these 3 bullets. And I will also tell you that you can use the number X to quantify it. Thank you, Bianca, for being the first one to put it in there. Well, it's already 1:27, but I really want to get a couple more. 1 more minute. All right, never mind. 2 more minutes. 1:29 or 12:29, maybe where you are. Thank you, Melanie. Okay. Thank you, everybody. And Bianca, obviously, I don't even know you, but I'm going to start with yours. And I hope you believe me when I tell you, I picked on all the doctors' efforts to do this. They were all in the room, and I said, thank you for letting me rip you apart because I'm going to teach everybody else. So I don't even know you, but I hope you're not going to be offended because everybody's going to learn from this. And the fact that you were willing to put your problem statement in there and most people weren't means the world to me. So thank you so much. So I wrote it down so I don't have to stare at the chat for hers. So I'm reading it out loud. Which way should I bill for telehealth so we can maximize the budget? And I'm going to start with, I'm not going to ask for a chat on this. I'm just going to babble again. Which way should I bill? And I'm going to ask, is that problem stated as a problem? And I'm going to suggest to you, no. Which way should I run down the street? Which way should I eat an apple? Which way should I? It doesn't sound like there's a problem stated. I don't know that there's something wrong. Maybe you're doing it right. And if I tell you do it the way you're doing it, you don't have a problem. So we can maximize the budget. It says to me there's something about making money. And I totally understand. So I'm making up, again, you don't have to answer me, Bianca, I promise, because everyone else will struggle with this too. There's something to do with your budget that's going wrong. And I'm going to make this up. I have no idea what your problem is. But maybe the problem is that every patient that we see by video visit, we spend more money on the doctor's time than we get reimbursed by Medicare. Again, I'm making this up. Or maybe you would say 80% of our Medicare patients who get care by video, we spend more money based on per hour reimbursement to the doctors than we get reimbursed. And I would say that is stated as a problem. And obviously X percent, I said 80%. The problem would be quantified. It's stated as a problem that we're losing money on every telehealth visit. And are you confident in others? You say, so what? No, we're not confident at 80%. I mean, I think most people agree that if we're losing money at 80% of patients getting care a certain way, suppose that number was 20%, I'm not sure we would agree on that. So Bianca, if you have any comments, and Melanie, I assume, and Chris and Arif, that you don't want people to speak out loud. Is that right, Melanie?
We typically just have it listed as our chat.
Okay. So Bianca, does that make sense to you, what I just said? Just put in the chat if it makes any sense. Does that it also could be that not that we're not losing money, but there's no profit. I mean, it could be a different problem, but I'm just getting you guys to all understand how to make sure it's stated as a quantified problem. So Bianca, totally good. Okay, let's take one more. Let's see. X% of patient visits. This is Lisa. Thank you, Lisa, again, for willing to put yourself out there. X% of patient visits occur in person in primary care, with X percentage of those visits meeting the criteria for a telehealth visit. Increase video visits by X% by. Okay, first of all, you have a nice job with a goal, and you have a nice job with the with the quantification. I might challenge you, and again, I'm going to challenge everybody. 100% of people I'm probably going to challenge, because I've been doing this for many years. I would say, so what to that? So what that X% could be done by video, but they're done in person. So what? So Lisa, maybe put in the chat, tell me the so what. And if it has to do with, I'm making this up, what it could be, that we're better off financially if we do by video, but then I would want to see those numbers. Or suppose, when I led virtual care for a long time, my tagline was, and it failed, this did not happen, stop building buildings. Imagine how much money the healthcare industry could save if I'm exaggerating to make a point, had all clinicians work from home unless they had to see the patient in person. We would need much smaller buildings, right? And then we could spend the money on paying doctor salaries and physical therapy salaries and not on buildings, and that makes a lot more sense, but nobody did that. Okay, I'm looking at Lisa's response. By transitioning to video visits, open access for patients who need an in-person visit. Okay, Lisa, again, I'm just babbling. So then I think the problem you're trying to solve is, on average, patients are waiting 2 years for their first primary care visit. I struggle with the who need an in-person visit. Maybe you could say, maybe you don't need to put this in the chat, but maybe we could say, like, someone who's coming in for that we definitely need to see them in person, like a mammogram, that people are waiting 2 years on average to get their first mammogram. And then I would suggest to you, that doesn't mean the telehealth is a solution, but you might say it's a solution. I hope you guys are getting at what I'm getting at. And I'm gonna I hope I'm pronouncing it, Michaela, we need to increase our use of telehealth by 40%. And again, I'm gonna get right back to you. We need to is not stated as a problem. It's quantified, but I would like to hear what's the problem we're trying to solve. So if we increase our use of telehealth by 40%, what problem have we solved? Michaela, if you want to respond to that, what's the point? Why do we need to increase it? What difference if we increase it or we don't increase it? And while I'm waiting for Lisa, Michaela, if she wants to respond, if you don't, that's fine. Oh, my phone's ringing. I need to hang it up. That's because of a text. I'll hang it up. Anybody else want to have me pick on your problem? And obviously, when I say pick on it, use it to keep helping you understand what I'm trying to get at. Okay, well then I'm gonna go to the next, go to the next slide. So the most important thing is what I just went through. Stating something is a problem, having it quantified, and making sure it's not a so what to the group that decides how to spend the money and to the group that you need to do something differently. We can go to define the goal, but I would love to answer questions first. So why don't you put your questions in the chat? And I'll be disappointed if there's no questions because I can't believe I went through everything perfectly. There must be something I wasn't clear on, or you don't agree with me on, or you want to push back and say, I have a different point of view. I would love to hear any of those things. So Michaela answered me, we live in a very rural area. We are not serving hundreds of clients that desire service. Good. So hundreds, okay, the number is there. And I guess my question would be, how do you know if you've solved the problem? So suppose I'm just pushing back to teach everyone else. This is really hard. Suppose you start offering care by video and many, many, many people use them. They're used all day. But they're people that don't really need care. And you're making it so easy for them to get care that it's not solving the problem you just said. Would you be satisfied with that? And in fact, again, when I led virtual care, and I still feel this way, with Kaiser Permanente, I don't even know if this is still true, but it probably is. Kaiser Permanente, at least in Colorado, when I led it, we had no copays for care by video, and I completely disagreed with that. In my not so humble opinion, we should have people pay a copay approximately based on how much time a clinician is spending. So if you're doing it on the phone calls they did before I started with KP in 1999, phone calls, no copay, and I disagree with that. If you spend 1 minute with them, we'll charge you $1. If we spend an hour with you, you'll spend $100. I'm making this up. But I was worried, and I don't have any proof on this, but I'm still worried that care by video with no copay will make more of us that have a cough, like you just heard me cough. No sore throat, but I have a little cough. Do I need to go to the doctor? Obviously not. That's my not so humble opinion because I'm not so humble. But how many people are we going to have not go to the doctor and it's a waste of time because we need doctors to see people that really need to get seen and not the ones that, oh, there's no copay or it's $5 copay and I can get care, but you're still wasting the doctor's time. So just a point of view. All right, let's see what Beatrice said. Talking about behavioral telehealth in a rural healthcare setting. There is a discrepancy between what patients want and what providers want. Providers stay on if we let them do telehealth. Is that a good enough reason? Okay. All right. Then I don't have an opinion on whether that's a good enough reason. It's not up to me. It's up to your people. The problem I would state it is our retention rate, I'm making this up, Beatrice, our retention rate of primary care physicians, you didn't say primary care, or it could be behavioral health. Our retention rate of psychiatrists in 2024 was 5%. We lost 95% of them. And when we did a survey to ask, why did you leave of these 95% of them? 80% of those 95% that left said it was because I want to do care by video from home. If you simply said we have a 5% retention rate, I would still push on you saying, so how do you know telehealth is the problem? And you could answer me saying, we're going to try it. We're going to try it as an innovation approach, do it for 3 months and see if your retention rate is any better. Or you could ask the doctors, why did you leave, and try to get more data. I hope that makes sense, Beatrice. We do mental health and we require an assessment prior to accepting, Michaela. We do mental health and we require an assessment prior to accepting folks to care. Michaela, I'm not clear on what you're saying. We live in a very rural area. We're not serving hundreds of clients that desire service. We do mental health and we require assessment. Okay, so Michaela, I guess you're basically responding to the fact that you have an assessment in advance to know that these people do require care. So let's go back to above. Okay, so I would state it as, and then I'll go to Lisa. I would state it as our mental health clients, and maybe you are only mental health, but our mental health clients, for which we have proof that clinical care is required. X% of them have let us know, maybe through a survey, that they're not getting care because they can't get to us physically, or not getting care because I don't have the time to drive the 3 hours or something. And you had a survey and said that. So let me say it again. 50% per survey, 50% of our mental health clients have let us know that they are not getting care from us because they don't have the time. They don't have the time to drive to and from us. You could say that, or 50% because they don't have a way to get to see us. And that would be stated as a problem. It's quantified, and I don't think others would say so what. Let me look at Lisa. Oh, good. You said you have multiple surveys. So you can ask, and then you could say, the survey says they're not getting care because, and we have an assessment that says they're in bad shape. I'm obviously just being quick. Let's see what Lisa says. In your slide with the diagram leading people to change, the first box is to identify change approach. Is the approach the problem? Lisa, I'm not sure I'm responding to this or not. Let me say what I said and then put another thing in the chat to see if I've responded to that. The change approach, oh, that could be. If you are literally, and this is what we did at KP Colorado a long time ago and we failed. We basically said, doctors, you're going to do this. We're going to train you. We're going to give you webcams, go. That was the wrong change approach. We absolutely failed, but we did it very fast. And when I say it took a year, but we trained over a year. So doctors were ready in a month, or as soon as they got their training, they could do it. They didn't. So yes, the change approach could be the problem. And so how would I state that? I'm thinking. This is a really hard one for me. This is kind of a joke because I don't think I'm doing a good job on this one. 1,000 physicians were trained in 2024 and provided the technology to provide care by video visits. They had no opportunity to, 0% had the chance to let us know why they thought it was a bad idea. I'm thinking about surfacing resistance. We had 0 executive sponsors to help us address the resistance. You guys, I'm kind of joking because this is, Lisa, that's a really hard one. That's a really hard one. So I'm failing like the rest of you. I don't know that I don't know if I have an answer for that, but I tried to answer you. 0% this, 0% that. So I'm proposing to you that if we gave time for them to if we gave time to the leaders to surface resistance, so we find out why people don't want to do it. And I will tell you, this is another example. I have so many examples of failure. The urology department, we asked every department what they thought the best use case would be. Again, this is before anybody had done it except for the Veterans Administration. They were first. And the urology department leaders, just the leaders, said erectile dysfunction. Okay, so I went and met with the chief of the department, the chief urologist, and I met with all the urologists. And we asked what everyone thought after we talked to them, and then we trained them all. And one of the urologists, I don't remember his name, I think it was a guy, he said, I'm really worried that we're going to miss a cancer diagnosis. I'm not a doctor, I'm a physical therapist. I don't know anything about urology except I know what it is. I can't answer that. And maybe the chief of urology could, but maybe they're right. And what do you do? But that's the kind of thing we need to, on the other hand, this is a great story also. I'm 68 years old. I'm 5 feet tall. I weigh 100 pounds. I went through menopause, whatever, 18 years ago, and I was diagnosed immediately with osteoporosis. I'm very little. I have very little bones, and I go see an endocrinologist every 3 years. And I actually said, I only go now. I went a month ago, only because I want to go and say hi to all my doctor friends. I call the docs by the first name. There is nothing to see. There's nothing to touch. There's no reason to take my clothes off. She needs to know the results of my bone mineral densitometry. She needs to know my lab values for calcium and vitamin D and whatever else she needs to know. You know more than I do, some people on the phone. But she doesn't touch me, and there's nothing to look at. So that's an example of, you think you're going to miss cancer if you provide care by telehealth. Okay. Oh. Going back to the approach. The approach again was tell people what to do, tell them you're going to do it, go do it, versus go through this whole process, which is really painful as I'm going through with you. It's a lot slower, but you will be a lot more successful in implementing. I have lots of experience with this. Once I added to, when I got trained as leading change, added to the problem, identify the quantifiable problem to solve that's meaningful to both those parties, everything changed. It was a lot slower and I was a lot more successful. Any other questions? I guess I'll know if I did a good job today if you come back for the next one. So let's go through defining the goals. I will tell you, as you can probably imagine, this is really easy if you've done a great job defining the problem. So making a goal means you're addressing the problem. As you said, the problem I'm trying to solve is, let me make one up, that 80% of our patients diagnosed with hypertension have zero improvement in their blood pressure after 6 months of treatment by the Kaiser Permanente care team. Okay, that's the problem. So the goal has to be exactly identifying the problem. It has to be, well, what do I want it to be? Do I want it to be zero? Do I want, and maybe I should change the problem to 80% saw only 10% improvement. And maybe I want it to be down to 10%. 10% of our clients who got treatment from us with hypertension saw only 10% improvement in blood pressure. It has to be quantified, and to quantify the exact same thing you set in the problem, which should be easy if you identified a clear quantified problem. But as I say that, it's not easy because nobody agrees. In fact, when we implemented remote monitoring, we did it nationally: California, Hawaii, Colorado, mid-Atlantic states, Oregon, all the different regions. And we couldn't come to an agreement on what successful looks like for some problem we were trying to solve. We couldn't come to an agreement because the doctors didn't agree. So we all decided, okay, we've come up with a problem to solve, but we will decide at a regional level what the goal will be and in how much time. It has to include the time too. And it was still hard, but we had executives involved, and so they could be a little more pushy. I heard time balance the outcome. So that's really important too. Not just we want to get it from 80 to 10%, but we don't want to take a decade to do it. Do we want to do it in a year? Do we see the results in 6 months? And my suggestion is, again, I led innovation as well as virtual care, is if you don't see the results, let's say you want to see it in 3 months, and for telehealth, I would say that's too short, but whatever, you come up with your goals. Let's say you don't see the results in 3 months, then you guys, whoever you guys is, whoever made this decision to implement, whatever you're going to implement, can decide, do we want to give it a lot longer because we think we're moving in the right direction and look at it again in 3 more months or in 6 more months? Or do we want to try a different approach? And that could be. In fact, this is kind of a sideline in leading innovation. When we used to do pilots, you can quote me on this. In fact, Mel, I would love it if you would put this in the chat for everyone to see. What can you try by Tuesday that won't harm a hair on a person's head. That's pilots. We don't need every doctor and all 1,000 docs to try video visits by next Tuesday, but I could have one doctor do it. Let's have one doctor try by next week, one video visit with one patient and see how it goes. And you could try that. That's a lot better than we're training 1,000 physicians, giving them all webcams, tell them to go, and we'll figure it out later if there's problems. And involving senior leaders. So with me, this is bad. Again, I'm only a physical therapist. I'm joking. I think it's a great career, but I'm a physical therapist, not a physician. I was leading physicians. I worked for the medical group. I generally went to meet with the departments on my own, but when they had a lot of resistance, or if I knew in advance or the chief of the department told me that, I absolutely brought my boss, and my boss, he's not on this, but Bill Marsh was the best boss on the planet for me. He was an executive position with the Colorado Permanente Medical Group, and he would be there. I mean, if I said, I can't do this myself, Bill, they're not going to listen to me, and I don't blame them. They disagree with this process. It's not up to me to tell them they're wrong, because I don't have an opinion on whether they're wrong if they're going to miss cancer. I need you there, and he would go with me. Okay, let's go to the next slide. Okay, so I've already said this. Okay, let's go to the next. Okay, good. In 6 months, so that's in how long, we will obtain a 30% decrease in the number of pressure ulcers in our IC patients. Perfect, as long as the problem statement was currently I'm trying to figure this out. What would the problem statement be? It's something about the number of pressure ulcers in an ICU. Currently, we have 50% of our patients in ICU have pressure ulcers. I'm just making that up, and this would be the goal. Or in 6 months, we will obtain a 50% reduction in pressure ulcer minus 50 pressure ulcer. Okay, and the problem with the second one, it's fine. It's certainly stated as 2 problems that are quantified in how much time. But what happens if you achieve in one and not the other? And I'm not saying that's a problem, but it's important to understand. Suppose one group thinks that the first part of the problem is stated as the problem we need to solve, and we solve that. Another group thinks the other problem is the problem to solve. You solve one but not the other. Did we succeed? So I'm just telling you to be careful if you have 2 problems, because again, if you solve one and not the other. If the doctors that are providing care agree that we've solved the problem, but the ones paying the money for it and deciding who's going to get promoted and who's going to get a bonus doesn't, we have a problem. And I certainly face that. And I couldn't solve that problem of the executives and the care delivery physicians did not agree on what amounted to a problem we're solving, whether it was the actual problem or how bad it was. And we needed to figure that out before we went live, or when we finished trying something out, how would we decide if it's a solution that was worth having? Thank you, Melanie. What can you try by Tuesday that won't harm hair on a person's head? That's just about short pilots that you might want to try with one person that's excited to try this versus what we did, total failure. All right, see, I'm almost done. Okay, next slide. What time is it? Oh, perfect. I don't even like these. I wrote these a long time ago. Patients on all surgical services of our hospital have less pain. I'd rather see numbers still. Okay, next slide, last slide. I want to remind you all that every one of us in this group, including me, we all resist change. It doesn't have to have anything to do with healthcare, but we all resist change. And if you can't think of anything, I'll help you. I can certainly tell you my resistance to change many times. And the last slide is my contact information. And you're going to see these slides online. And believe me when I tell you, I would love to hear of you. Let's see. Oh, there's only 21. I thought 60 registered. Okay, whatever. I would love to get feedback. We will get feedback. What could I have done better today? What was the most helpful to you? And obviously, I'll have a sense of satisfied with you. The next session is going to be about surfacing resistance, which is critical, and we'll talk about why, and how important effective sponsorship is. And I will certainly tell you my stories. The end.
All right, thank you very much, Jan. I just want to let everybody know that the next session is scheduled for Thursday, October 23rd. Please go ahead and check out our website and get that signed out. Everybody that joined today, I'll send out a thank you email with that information as well. We're going to go ahead and I'm going to go ahead and get the transcript printed, Jan, and let you take a peek at that, and maybe we can put together a little article on some of those questions and examples, and maybe address them a little bit more, having a little more time to look at that. All right, so we are just about done. Again, thank you for joining us. Please double check our website for upcoming sessions. Like I said, Jan will be coming back in October. And next week, we also have a webinar with Carol Yarbrough, who is taking a deep dive into telenutrition services. I might want to check that one out as well. And that's kind of and she'll be doing another webinar in October on care management services, again, with focus on nutrition. We've got teleaudiology coming up in October, the beginning of October. We're just finalizing that. And also, if you're interested to learn more about the Arizona Telemedicine Program, we have our quarterly Arizona Telemedicine Council meeting, which is going to be in October, and everyone is welcome to register for that and sit in. That'll be on October 15th at 11, from 11 to 1. And coming up in November, we've got Valley Fever Awareness, and we're working with the director of the Valley Fever Center of Excellence, and we'll be doing a webinar on that. And we also have some tele-rehab webinars coming up in November as well. So we got a lot going on before the end of this year. Please visit us, and thank you, Chris, for going ahead and putting up the link in there. I'll have that in my thank you email as well. And with that, we're going to go ahead and give you 2 minutes back to your day, everyone. So thank you for joining us, and we will see you again on one of our next events. Take care, everyone.